Hey, digital diamonds! It's time for another digital gem. Let's go! Welcome back to Digital Healthcare Solutions, a healthcare network developed to equip, empower, and encourage a thriving digital healthcare nomad community. In today's Diamond video, we are honoring our commitment to review the concept of time, as it relates to CPT E&M coding, in addition to delving into face-to-face time and unit floor time. Let's go! In the context of E&M coding, the concept of time holds a different meaning depending on the category. It is essential that not only professional medical coders know how to properly identify and correctly capture the correct medical code for time. It is also extremely important, if not an imperative, for physicians and qualified healthcare professionals to understand these differences to ensure accurate documentation and coding practices. While remembering, there's always a precious patient and a medical practice behind every medical record and medical code. Do you recall why it's so important for physicians and qualified healthcare professionals to understand how to correctly document their patient charts to reflect the time spent with their patients? Exactly. Proper documentation of patient encounters and time spent with patients is critical for accurate billing, compliance with regulations, quality of care, and legal protection in the event of a malpractice lawsuit. Clear and accurate documentation supports and protects everyone. Clear and accurate documentation allows healthcare physicians to track a patient's progress over time and make informed decisions about their treatment plan, while supplying insurance companies with the documentation required for reimbursement. Insurance companies require detailed documentation to justify reimbursement for billed services. And incorrect documentation may result in denied claims, loss of revenue, and/or legal action against the physician and/or medical practice. Whereas, accurate and complete documentation can help prove that the healthcare physician provided appropriate care and treatment to the patient. Okay, another thing to remember, your CPT codebook and the enclosed guidelines should be one of your best friends as a professional coder. Never code without reviewing the applicable guidelines. So, let's review the E&M guidelines. According to the CPT E&M guidelines, the time section outlines rules for various E&M codes, including office and outpatient E&M codes. The primary point for these codes is that the total time spent on the date of the encounter determines the appropriate code. The total time includes both face-to-face and non-face-to-face time spent by the physician or qualified health professional with the patient on the encounter date, and this would include reviewing tests and coordinating care. Stop. Did you actually pull out your codebook and review the codes referenced? Nice job. Now you are studying like a true digital diamond. Did you notice the descriptors for the office and outpatient codes? They include a specific time range for each code. Great job! Now, did you notice the specific time referenced? Look at the descriptor for code 99213. Notice how code 99213 states, when using time for code selection, 20 to 29 minutes of total time is spent on the date of the encounter. And what about code 99215? 99215 states, when using time for code selection, 40 to 54 minutes of total time is spent on the date of the encounter. As long as the documented total time spent on the encounter date falls within the specified range, your code selection should be accurate. Again, selecting the correct code based upon the documentation is imperative. In contrast to office and outpatient codes, many other E&M code descriptors characteristically indicate the amount of time typically is spent on a service level. However, these times are averages and represent a range. One patient encounter may have a time that is longer or shorter than the time in the code descriptor, depending on the clinical circumstances. Please note, physicians may use the time listed in the code descriptor to select the appropriate E&M service level, rather than the key components, but only when counseling and coordination of care dominate the visit. Double note, the times listed in the non-office E&M descriptors are intra-service times, which includes face-to-face time or unit floor time, depending on the type of service. Let's drill down face-to-face. Face-to-face time represents the duration of time that the physician spends face-to-face with the patient and/or members of the patient's family, including history taking, examination, and counseling. The physician may also spend time reviewing records and tests or arranging further services for the patient, which are not included in the intra-service time listed in the E&M code descriptor. Face-to-face time is used for a myriad of services, including outpatient consultations, domiciliary, rest homes, custodial services, home services, cognitive assessments, and care plan services. And let's not forget to break down unit or floor time. Unit floor time is used for hospital observation services, hospital inpatient services, inpatient consultations, and nursing facility services. Unit or floor time represents the duration that the physician spends providing services for the patient, while being present on the patient's facility unit and at the patient's bedside. This time includes creating or reviewing the patient's chart, examining the patient, writing notes, and communicating with other qualified healthcare professionals and the patient's family. This time includes creating or reviewing the patient's chart, examining the patient, writing notes, and communicating with other qualified healthcare professionals and the patient's family. It's important to note, insurance payers are aware of the total work involved in patient care and may use that as a factor when setting rates, even though the time spent on pre- and post-encounter activities is not included in the intra-service time calculation. As a reminder, intra-service time is the actual time spent performing the service or procedure on a patient. Moving on, when selecting office and outpatient E&M codes, there are two options: total time or medical decision-making, also referred to as MDM. If the total time falls within the range in the code descriptor, you may report that code. However, be mindful: digital diamonds. Using time to select a non-office E&M code is more complicated. In some cases, using time to choose a non-office E&M code may result in a higher level code than using history, exam, and medical decision-making. But you should only use time as the controlling factor in your non-office E&M code selection when counseling, coordination of care, or both make up more than 50% of the face-to-face time with the patient or family, or more than 50% of the floor or unit time, depending on the nature of the service. Then, there's counseling. Counseling involves a discussion with the patient's family, or both. And these discussions may cover such subjects as diagnostic results, impressions, or diagnostic studies recommended for the patient's prognosis, treatment options, which may include risks versus rewards, instructions regarding treatment or follow-up, reasons why complying with the selected treatment or management options is important, how to reduce risk factors, and education for the patient and the patient's family. So, as we can see, counseling is all-encompassing. Let's cover family as well, because we're sure you have noticed. Clinical and coding descriptions are never exactly what we initially think. Family includes those who are responsible for patient care or decision-making, such as foster parents or a legal guardian. However, payer rules may differ from CPT-registered guidelines, such as requiring counseling and care coordination to occur in the patient's presence. So, you can now better understand, to appropriately and accurately support this type of E&M reporting based on time. Documentation should include the extent of counseling and/or coordination of care. The 1995 and 1997 documentation guidelines states that the physician should document the total length of time of the encounter and the counseling or activities performed to coordinate care. The documentation also needs to show that the encounter exceeded the 50% threshold for time spent on counseling, coordination of care, or both. In the best-case scenario, the physician or qualified healthcare professional's documentation of time for an E&M visit should include the beginning and ending time of the counseling and/or coordination of care, as well as the beginning and ending time for the overall face-to-face or floor service. The physician or qualified healthcare professional should also include the components of history, exam, and medical decision-making in the documentation, even if this represents a brief note. Using time as the determining factor to choose the E&M level does not change documentation requirements. Pop quiz. This is Karen. No, not a Karen. Let's just say, this is Karen Smith. Karen is a 34-year-old female patient who exercises regularly, has an 8-ounce cup of coffee each day, and peruses social media at least 6 times a day. No judgment here. Karen is visited by her oncologist surgeon who spent 20 minutes of a 25-minute subsequent inpatient visit, discussing her test results and treatment options. Okay, digital diamonds, how should this encounter be coded? Do you have your CPT codebook open to the E&M section? Are you in the correct subsection? Do you have the code yet? Nice job! We selected code 99232 also, based on the 25 minutes documented for the total visit, and for the percentage of time spent on counseling Karen. Digital diamonds, please make an important note. If the E&M codes you are choosing from have no reference times, you can't use time as a controlling factor when determining the appropriate service level. And this is why, to properly select an E&M code, it's important to understand what should not be included in the code. Here are a few things to keep in mind. Performance and interpretation of diagnostic tests and studies ordered during the E&M service should be reported separately, as long as the documentation meets the requirements for separate reporting. Sometimes it may be appropriate to report a procedure or service code on the same day as the code for a significant separately identifiable E&M service. However, the documentation must show that the E&M service meets the requirements of the appropriate E&M code's definition, and the work performed for the other procedure or service should not be counted when determining the E&M code level. In these cases, the appropriate modifier should be appended to the E&M code to indicate that it meets the requirements for separate reporting. Sometimes it may be appropriate to report a procedure or service code on the same day as the code for a significant separately identifiable E&M service. However, the documentation must show that the E&M service meets the requirements of the appropriate E&M code's definition, and the work performed for the other procedure or service should not be counted when determining the E&M code level. In these cases, the appropriate modifier should be appended to the E&M code to indicate that it meets the requirements for separate reporting. Unlisted E&M services and special reports are two additional concepts to keep in mind. An unlisted E&M service is an E&M service that is not identified with a specific code in the CPT registered code set. To report these services, code 99429 should be selected for unlisted preventive medicine services and code 99499 for unlisted evaluation and management services. When reporting these codes, the CPT registered guidelines for E&M code states that a special report should be used to describe the service. This report should include a physician's clear description of the nature, extent, and need for the procedure, as well as any relevant physical findings, procedures performed, concurrent problems, and follow-up care. Using plain language in these reports can help ensure that insurance providers' payers understand the medical necessity of the service. Something else to note, the time component is not applicable to all E&M codes, such as emergency department E&M services, where it would be difficult to calculate time for any one patient due to the nature of the setting. As a professional medical coder, it is important to review each of the E&M code descriptors very carefully, because the component requirements for two codes at the same level may differ. For office and other outpatient E&M services, the code selection is based on the medical decision-making level, or the total time spent, rather than the 7 components reviewed in our deeper dive into E&M coding video. If you missed that video, go check it out. Just click on the link, review the video, and come on back. We will be here waiting for you, right where you stopped. For everyone else, please note, physicians should still document the encounter completely, even for components that do not drive code selection. And lastly, to bring additional clarity to counseling and coordination of care. Counseling and coordination of care are critical components for E&M coding and may be used as the key factor for selecting a particular E&M code if they make up more than 50% of the encounter. So, physicians and all qualified healthcare professionals must document the total time of each patient visit, including the time spent on counseling and coordination activities. Elements not involving face-to-face time, such as reviewing laboratory results or telephone calls, are not included in the time stated. Well, that's it for now. As promised, we wanted to provide additional clarity to E&M coding. As you can tell, the layers to E&M coding are endless and entrenched in rules and guidelines. As always, we hope and trust this information will be used and shared as a valuable tool as you strive to be a digital diamond, a professional medical coder and/or biller, or even if you are starting your own billing service. But no matter what you do, remember, because you strive to be a digital diamond, you read everything, your knowledge is broad and expansive, you attract success, and you create the life that you want to live. Thank you for watching. If you enjoyed this video, please give it a thumbs up and consider subscribing to our channel and be part of the digital healthcare nomad community. Don't forget to hit the notification bell so you never miss a new upload. Your support helps us create more great videos for you. Thank you again, and we'll see you in the next one.